Batra. I am presenting for my group. We chose April Hernandez from the book Crazy to follow. We chose her because she is the most likely patient that we would see that presents themselves to the hospital. They are normally in an acute crisis. They are often disheveled. They appear to the ER unkept, so they haven't brushed their hair, brushed their teeth, taken a bath in a few days. They are most often homeless, hungry, and haven't had much sleep at all. So the nursing care, we have a lot of issues to tackle as nurses for our nursing care. This particular patient that presents themselves to the ER usually has a supportive family, a significant other. They have a history of molestation from a family member, multiple visits to the ER, substance/alcohol abuse, and most often are homeless and hungry. We will walk through the nursing process. We will talk about treatments. We'll talk about the emotional reflection, ideas for change. So first off, the first element in the nursing process is the assessment. So oftentimes they are admitted to the acute med-surg floor. They have lack of eye contact. They're ambivalent. They have poor self-care. They're unkept. They're disheveled. They have a decreased intake. They have poor nutrition. Lack of sleep is usually oftentimes why they're in there. They have a psychotic episode. They refuse their medications. They're paranoid. They have auditory hallucinations. They refuse therapy, and they deny need for help. Diagnosis: self-care deficit is related to hygiene, nutrition, and safety. Disturbed sleep pattern is related to lack of sleep. And it's oftentimes substance abuse and alcohol abuse has a lot to do with that. Disturbed thought process related to paranoia, delusions, and hallucinations. Risk for self-harm. These people are trying to cut themselves on their wrists, so they have bilateral wrist wounds. They're non-compliant. They refuse their meds, refuse ADLs, refuse care, refuse food, and knowledge deficit of the actual diagnosis that they have. What we want to see, we want them to be free from injury. That's our goal. We need to state why. We want her to state why she needs to take her medications. We want her to adhere to her medications daily so it can reduce the hallucinations, be free from delusions, identify sleep patterns, and practice restful sleep. We have participate in self-care, increase feelings of self-worth. And I have a little story. I had a little story to tell, but let me go to the next slide, because I want to tell you what happened to me a couple of days ago. So let me just finish this slide and then we'll continue on. Identify signs and symptoms, behaviors that lead to crises. So the implementation process, we want them to feel safe. We do not argue about hallucinations. And a couple days ago, I was at work and I have a gentleman who has schizophrenia, and he was yelling that these teenagers were shooting lasers into his legs. And, you know, he has leg wounds from itching and scratching all the time, and he has cellulitis. But I remember Peggy from the See Me presentation had said that if you ask them to stop talking or stop doing something while you're talking, that it would actually work. So I thought, oh, you know what? I'm going to try this. And so I went in there and I just said, you need to tell the teenagers to stop shooting lasers into your legs so I can speak with you. He's like, what? And I repeated myself. And so he told them to stop shooting lasers into his legs, and it worked. It was only for a couple of minutes, but I was able to talk with him. He still refused his meds, but it worked. I was pretty proud of myself. I kind of digressed for a moment, but I just wanted to share that with you. So educate about medications, assess for side effects, sleep training, encouraging them to have a structured daily routine, stay away from drugs and alcohol, limit the caffeine intake in the evening, daily ADLs and wound care. It's really important, especially wound care. Resources. Keep the resources. Let them know what type of resources they have. Evaluation portion. Paranoia has ceased and the hallucinations have improved. They have positive feelings and plans. We don't necessarily want them to have a long-term plan, but a short-term, like finding a part-time job. That's important. And having them identify critical signs and symptoms of a crisis. We will provide them with resources available to them. We will make their appointments, and the patient would be discharged. Treatments. Schizoaffective disorder is bipolar and schizophrenia. Not only do they hear voices, but they also have mood swings. And this is usually managed with medications and therapy. The only FDA-approved drug for schizoaffective disorder is Invega. So usually their medication regimen would be a combination of mood stabilizers and an antipsychotic. A mood stabilizer would be like lithium for the bipolar, and then an atypical antipsychotic medication like risperidol, Geodone, Seroquel, and there's one other, risperidone. So those would be in combination. And there is one, clozaril is the only drug that's proven effective for schizophrenic patients. They also use that, but it's a very powerful, dangerous drug. And if it's given to the wrong person, it can cause death. I worked at my last facility where we give out clozaril quite often, and a med error happened and a patient died because of it. So it's very important to have 2 nurses sign for that drug. Schizoaffective disorder is usually managed with medications and therapy. So on top of the medications, we would combine it with some therapy, like cognitive behavioral therapy, which helps change negative thinking with coping abilities. They have family, group, and individual therapy. The self-management strategies. These are really important. Learning how to pinpoint stressors and triggers, avoiding drugs and alcohol, establishing a daily routine structure is really important for these people. Forming healthy relationships. I know that's kind of hard for them because they have oftentimes burned a lot of bridges, but that's very important. Resources. Many benefit from living with family members, group homes for support, friends, significant others, and then they also have NAMI, psychiatrists, and counselors that are there to help. The emotional reflection that I took away from the book was the conditions in the jail were deplorable. I remember reading one time where a gentleman from the top bunk went straight down and head first into the toilet and died. That's not something that should happen. And Ted Jackson, another person from the book, he was worried, he was concerned because there was only one blanket, one bed, and one pillow. And he wanted to be interviewed and tell his story, but he was afraid that he would lose his pillow, blanket, and bed because there was two people. So they are still humans and they need to be treated as such. Mental health can affect anyone, rich or poor. They come from all socioeconomic backgrounds. When I was at Western State, I came across a young man, good-looking man, bright. He had the world at his fingertips, had a good family, had a full-ride scholarship to Berkeley, and he was diagnosed with schizophrenia. I don't exactly know what happened to him. I just know that his future had changed from that diagnosis. Ideas for change: preserving dignity. That's important. Reducing the impact and improving the quality of life for these people. Interventions that increase their independence, increase their self-worth so that they feel important, and improve quality of care. So the Healthy People 2020, their goal is to improve mental health through prevention and by ensuring access to quality mental health services. The Substance Abuse and Mental Health Services Administration identified 5 initiatives. They are to increase awareness, understanding, promote wellness, prevent substance abuse / mental illness, increase access to treatment. That's really important because we have such a lack of resources, especially in our community. I live in Pierce County, and you would think that they would have an abundant amount of resources for these people, but they really don't. Support recovery. Lastly, on a global level, the World Health Organization wants countries to limit mental health hospitals, build community health, like passageways in Miami. They had structure, they felt comfortable there, they felt safe. So that's important. Safety and structure and consistency. Develop services in mental or in community hospitals. This is more for the acute phase. In a crisis situation. Integrate into primary health care. So identification of a diagnosis early on is much better than having it escalate into crisis. Informal community mental health services. This would be like the crisis intervention team that a lot of the police officers and the organizations across the country have implemented to deal with mental health patients. And lastly, promote self-care. Do you have any questions?